Questioning.
Thank you, Madam Chair. In my home state of New York, there's been a 160% increase in the number of teens using e-cigarettes between 2014 and 2018. Many of these children use e-cigarettes in schools, and I've even heard from schools in my district that they're installing vape detectors in their bathrooms to catch students vaping. Teachers, principals, and school administrators have been thrust to the forefront of this epidemic, but schools, unfortunately, are not equipped to handle these types of public health cases. To that end, I've introduced the bipartisan, bicameral Smoke-Free Schools Act, which would ban vaping in schools and child care facilities. Schools should be places that promote healthy childhood development, but tobacco use jeopardizes their health. Dr. Tansky, I want to ask you, could you please describe how tobacco use hinders a child's brain development and how it can impact a child's ability to succeed in the classroom?
Thank you for the question. So as I mentioned in my testimony, we know that the adolescent brain is really quite uniquely susceptible to nicotine addiction. And if you think very simplistically, things kind of develop from the back to the front, and one of the final things that develops is our executive function and our ability to put our brakes on our own behavior. The pleasure center lights up first. So we know what feels good, and so that's why the adolescent brain is more likely to be addicted. We know it feels good, they try it, it feels good, and they don't have the brakes to stop their own behavior. So addiction is very prevalent in adolescents and in younger people, and we know that it impacts on their executive function. We know that nicotine can impair the way people kind of process and prioritize things. So indeed, it can make a big difference on school success. So someone who is struggling with either nicotine addiction or withdrawal. So if someone is withdrawing from nicotine during the classroom because they can't vape in the school, or because they don't have a vape, or they've put good restrictions on, they're distracted, they're irritable, they're anxious, they don't feel good. And so that also is going to impair their ability to be successful in a classroom.
Thank you very much. The science is settled that nicotine certainly has short-term and long-term health consequences for children. And it's my understanding that many e-cigarettes on the market today are much more efficient at delivering nicotine than traditional cigarettes, delivering nicotine at substantially higher levels and making these e-cigarettes potently addictive. In some cases, Juul pods deliver around 200 puffs, which provides the same amount of nicotine as a pack of 20 cigarettes. And what's more concerning is that research has shown that many young Juul users are unaware that these e-cigarettes contain nicotine. Juul threatens the tremendous progress we've made in reducing teen smoking rates to what was an all-time low of 10%. Mr. Myers, let me ask you, what enables Juul devices to deliver higher levels of nicotine than cigarettes?
I think this is an issue on which we all agree. Juul developed the science of using benzoic acid to turn nicotine into nicotine salts that delivers nicotine more efficiently, more rapidly, and allows smokers and young people to inhale more intensely because it eliminates the harshness. So what it means is that we have the double whammy. We have sweet flavors that attract kids to get them to try it, and then we have new technology that addicts kids more rapidly and more intensely than we've had before.
Thank you. Ms. Furman, let me ask you. In 2009, I helped pass the Family Smoking Prevention and Tobacco Control as a member of this committee. This legislation banned flavors in cigarettes since they were being used to attract kids. In the current e-cigarette epidemic, we're seeing a repeat of this industry tactic. In fact, nearly 97% of teen e-cigarette users reported using a flavored product in the last month. Last year, I was one of the first House members to call on the FDA to ban flavored e-cigarettes, and I'm pleased to co-sponsor Chairman Pallone's Reversing the Youth Tobacco Epidemic Act, which would ban flavors in e-cigarettes. Ms. Furman, in addition to flavors, what other marketing tactics have e-cigarette makers used to target children?
That's a great question. There are many. Flavors are the primary marketing tactic because it prevents the kids from perceiving harm. They don't think that there's anything harmful with gummy bear. They've also been targeting the kids on social media. They have hashtag vape tricks. The kids actually now have started taking over now that Juul has stopped their own social media accounts. Now there are hundreds and thousands of kids who actually do their own vape tricks. The size, the fact that they're deceptively innocuous. You can have them on a desk and they look like a highlighter or a flash drive. So all of these marketing tactics, and the fact that they can get them over the counter, they're available online with no age verification. Juul has a very strong age verification now, but many brands like Eon Smoke does not. So kids can order them and get them in 2 days, or they can go to the corner store.
Social media, YouTube videos, and teen-oriented magazines, the sky is the limit with this.
Exactly, and homework websites, as I said. Homework websites, social interaction apps, and games. They all advertise on those as well.
Thank you, Madam Chair.
The gentleman yields back. Now I'd like to recognize